All right. Good afternoon. I'm Senator Julia Kirt. I'm the Senate Minority Leader in the Oklahoma State Senate. We just heard a budget announcement. I'll just say up front that we don't have in hand spreadsheets. We don't have in hand anything that shows us the real deal that was just announced. I did just glance through the slides that were handed out to the media. Certainly wish I had a copy of that earlier. But I think generally what we heard was not addressing the fundamental challenges that Oklahomans face every day. Proposals that are not looking at our challenges around cost of living and the ability to get by. I think the big question to me is this budget actually solving real problems? Because what we heard was a lot about setting aside funds, a lot about cutting back services and programs without much about the well-being of Oklahomans and what could happen to improve their lives. I'm talking about housing solutions. I'm talking about things dealing with actual inflation, handling our child care crisis, and anything to do with making sure that Oklahomans' wages match their work. While we heard a lot about reforming social services benefits that help the least of these get jobs and get by, we heard nothing about reforming our corporate giveaways or our tax giveaways, and that's a great concern of mine. I think you see again, they're announcing this budget early in session, but is it early? Are we voting on it soon? Because if we don't have a chance to change it after the public's seen it, it is not early. To me, seeing a budget a month earlier means nothing if there's not an actual process where it can be updated and changed to reflect the will of the people. Certainly, Democrats seeing it as part of that because we represent districts that include 80,000 people just like they do. But it's also about the general public being able to give their feedback to the priorities the state is setting. And what's released today has not had any of that input. One-on-one deals are not public transparency. And what we saw was not transparency.
Good afternoon. Thank you guys so much for coming. I'm Senator Carrie Hicks. I represent Senate District 40 in Northwest Oklahoma City. And I just want to make sure folks understand that the Oklahoma Senate Democrats are still working to ensure that every child has a high-quality education in the state of Oklahoma. Asking teachers to do more for students with less is not going to move the needle on our educational outcomes. When we think about the proposal for a $2,000 pay increase for entering teachers or new teachers that are entering the profession, we have to understand that that might get us closer to the regional average as far as starting pay. But our salaries over time for career teachers and veteran teachers definitely do not keep pace with market forces that we heard so much about from the governor. Additionally, when we heard a lot about welfare reform, noticeably absent from that conversation around welfare reform and entitlements are vouchers. That is $250 million that is apportioned, it is set aside, it is off the top spending that goes to subsidize private education for wealthy families. And so if we're going to talk about true welfare reform and entitlements reform, that has to be a part of the conversation to ensure that all kids get a quality education in the state of Oklahoma.
Yeah, I just want to end with saying that, putting people over politics would mean getting a budget out earlier, allowing people to give feedback, really looking at the challenges that they're facing instead of leaving some of the baked-in backroom deals that we've seen all along where those who are wealthier and better connected are in the room. Everyone else finds out later what the decision was made. We remain committed to solving problems for real Oklahomans, and we are open to your questions. Thank you for coming.
What do you say to Chairman Caldwell's comments about the gross exaggeration about Democrats saying that they haven't been told anything about budget stuff?
Thank you for that question. So I was asked about the chairman from the House comment that Democrats have been looped in. One-on-one conversations is not transparency. So one Democrat getting to have a conversation about something specific in the budget, that is not transparency. Absolutely, Democrats are doing everything they can do to be in that conversation. We participate in all the budget hearings. We do the advanced research. We're doing all the studying. We're telling the budget chairman what we prefer. That is not public transparency. Last year, the year before that, we had budget hearings where we looked at those priorities. We laid them out. We talked about the fact that these were going to cost this much money. What we see now is a bunch of things rolled out, already decided. So if the budget is out and we're going to actually have a conversation and that budget can be amended, then I will change my tune. But right now what we're seeing is something that's landed, fully formed. Everything's been decided behind closed doors.
just want to add too. I serve on the Health and Human Services Subcommittee, which is the Appropriations Committee on the Senate side. And again, we receive our budget packets, we go to the budget briefings, and this year in particular, there was ICE concerns. We had to adjust our budget hearing schedule due to external factors, and the state's largest agencies under HHS umbrella were given 15 minutes to explain their budget request and to take questions from members in a public setting. This idea that individual members can get with agencies afterwards and have those conversations, we will absolutely do. We are not above that work. That's the work that we engage in every single day. But again, that is not public accountability, and that's not public transparency. When you're talking about moving the state's Medicaid program, which was just voted on by the people in the state of Oklahoma, to a statutory authority, that is a substantial change. I've been looped in on 0 conversations involving any of those proposals, and I show up to every meeting prepared and ready to ask questions. I've just not been given the opportunity to do that.
On that state question, would moving it to state statute, would that not allow a future legislature to then repeal it if they wanted to?
Yeah, as soon as it's in statute, it can be repealed anytime by the legislature. And that's what we anticipate will happen, that they were laying the groundwork now by saying that Medicaid's failing when we know all of us pay when people are not insured. The reason Medicaid expansion mattered was it kept our rural hospitals alive, and it also reduces healthcare costs for all of us because uninsured folks cost all of us. And so implying it failed when literally the governor is the one who hired managed care organizations to come in and run it and cost contain. And what we see is not a big dollar increase in Medicaid expansion. Working Oklahomans, what we see is the overall cost of healthcare has gone up. Yes, it has. We need to work on that rather than dropping people off, stripping them of their healthcare.
One of the things Representative Caldwell said kind of in passing was that he had yet to see a budget proposal from Democrats. I'm wondering if you guys had even known that that was an option, that maybe propose your own full-on budget?
Well, this is the same thing that our colleagues will say when they say you should run a bill on it. So we can spend our time working on things like a very detailed budget of our own. Is it going to be taken seriously? If I see a process where all those decisions are made behind closed doors, I am not going to spend the time to run a detailed budget and hand it to them. That is not meaningful contribution. So what I try to do is participate in the process that exists now. And for me, that's the appropriations meeting. That's also talking to the budget leadership. That's reviewing bills carefully that have a fiscal impact. We have seen a bunch of bills that don't have a fiscal impact but are going to be in that budget. So I don't think it's a fair comparison. We're glad to do the work, but we're not going to waste our time when we're not included in a process and when the public's not included in a process.
What are some things that just the average working Oklahoman out there who maybe doesn't pay a lot of attention to what goes on at the Capitol, why should they care about all these numbers we're talking about here? I mean, what are some things that you feel like should be in this budget that maybe aren't included?
Well, I hear from a whole lot of folks about people who have mental illness and have challenges in their community. I have lots of folks who are caring for loved ones with mental illness who are trying to get access to help. How's our mental health system? We know that we still don't have solid numbers on what we need to make that system better. We know that we have an increased number of people waiting in jail for a competency assessment. That's deeply troubling, and people should be worried if people are ending up on the streets, in hospitals, or in jails instead of getting mental health treatment. That is part of our system.
As far as,
Can you want to add something?
Yeah, child care. What we've seen from the DHS budget request was really looking at reducing the subsidy rates for families. And as I've been knocking doors and I've been talking to the constituents in my community and watching the headlines as well, what we're seeing is that decades-old operators of child care facilities that are tried and true, trusted, incredible facilities like Integris are choosing or have been given the choice, basically, to close their operations, leaving working families without a safe option for their child care needs. Chesapeake closed down their child care facility. OSU OKC closed their lab school. This is a recurring situation, and when DHS says we are going to reduce the amount of subsidy provided to family or folks eligible to qualify for child care subsidy because of a budget issue, that is not solving problems. That's creating problems, because what's going to happen is that individuals will now have to make the choice to leave participating in the economy to have to stay home to take care of their children. And I'm sure there are lots of folks that make that choice for their family already. But when you're feeling forced into that decision because childcare is failing, the entire system has not recovered from the pandemic, that is not a choice that families are making for themselves. It is a failing system that they are owed a sincere response from our government.
As far as education is concerned, I know they were upstairs, we're talking about, this is a historic investment. This is the third time that teachers have gotten a raise since Governor Stitt has been in office. And I mean, is this enough to solve Oklahoma's education problems? What would, if you were drawing this budget, what would you have allotted to education and for what purposes?
So, I mean, we did a deep dive into the Mississippi Miracle ahead of the session because we heard that was something that was very palatable to our colleagues across the aisle, and they were very interested in how we can replicate those literacy successes that the state of Mississippi invested in. And I will tell you that we're not even close to being able to match the investment. So when you're talking about salary in one silo, you're talking about literacy supports in other silos. The state of Mississippi, our student population is about 1.6 as many students. So you have to adjust for the student enrollment. We would need at least $39 million just in startup funds this year. The state of Mississippi also had a benevolent charitable gift of $100 million to seed that program, and that gets lost in the conversation. So unless we have some outside funder that I'm unaware of at this point in time that is waiting in the wings to match that investment, we are not going to see things drastically improve based on what I've been able to see on the calculations. And what I just want to remind everyone is that 1 cent more than last year's appropriated dollars would be a historic investment in education. We are still $2.1 billion behind the regional investment per student. $2.1 billion. So to think that children in Kansas and Texas, Arkansas, New Mexico are getting a much different educational experience than the students in Oklahoma, the legislature needs to answer for that shortcoming and that underinvestment.
It was asked whether or not the legislature could allot funds for schools to also give support staff a raise in addition to teachers. The answer up there that was given was no, that would be a local district decision, and that administrators should look into cutting their salaries to fund that. Is that an appropriate, avenue to go down for this?
For folks who really want to talk about market forces and being competitive, I mean, the numbers are clear and they're black and white when you're looking at education. We are not investing at a level that will actually make our students successful. And so if you want to blame it on administrators, or you want to blame it on support staff, or you want to blame it on teachers, the reality is there's not enough in the system. And who is responsible for funding the system? The legislature. So the responsibility lies squarely on our shoulders to ensure that there are enough resources that will adequately be able to pay for a support staff increase. We're seeing that, there is a COLA included in this deal. But again, it's a shell game. We're moving money around. We're not finding new streams of revenue. This is not a sustainable solution to the long-term challenges that we're seeing in education in particular. We've seen a 100% increase in adjunct instructors. These are individuals who have no college degree, who have limited experience and are being given a teaching contract that comes in at that starting base level as a certified teacher. And they're not trained for the challenges that we're currently experiencing in our state. So if we want to be honest about being competitive in a market environment, then we have to be honest about the numbers, because right now, blaming one entity or another, it allows them to shirk the responsibility that is entrusted into the state legislature.
Yeah, and I want to add on that. I'm just looking at what I printed from the House portal, because that's the first spreadsheet I have. Was trying to wish that thing would let us print a big spreadsheet. Is that every dollar that I see here added to the State Department of Education budget is earmarked for something specific. So we're not sending extra money to districts for them to make those kinds of decisions about what their local district needs. Do they need more special education assistance? Do they need more support staff raises? We're not giving them that option with this kind of funding when we earmark it.
Can I ask you,
No. No, we'll be working on that, trying to get answers, yeah.
I mean, I
Yeah.
will say, we've been involved in the conversations around the legislation that's run, but when it comes down to the nuts and bolts of what that actually covers, I don't know. So I want to be honest in saying that we have been involved in conversations around the literacy efforts this year and definitely on the math pilot program, but what is actually included with the spending that we're seeing on this spreadsheet, I don't have those details.
And just kind of touching on what you all have just spoken on whether or not this is enough to improve our education outcomes, just on the reading specifically, when you actually see the dollar amount they're willing to attribute to that, comparing that to Mississippi, it seems like, I don't know if it's comparable to what Mississippi accomplished, but I'm just curious, is that amount, now that it's in black and white, enough, sufficient to improve our reading scores and accomplish what we think needs to be accomplished?
Well, here's what I do know. I do know that we usually end our academic year with about 5,000 emergency certified individuals. I do know that we've seen a 100% increase in adjuncts, which is, we're at about 2,400. That was the latest numbers in 2022. And so if we're actually going to improve the instructional quality, what is being proposed doesn't even begin to allow us to be able to attract certified individuals who have left the classroom. There are a substantial amount of individuals, I'm one of them, right, with a teaching certification that is not currently in the classroom. So if we want to actually tackle the instructional piece, I don't think we're getting there yet. When I looked back towards what those numbers were for Mississippi, this is obviously, decades old now, and so it doesn't adjust for inflation either. But $39.2 million would have to be set aside just for the literacy component. And so when you're looking at the $60 million overall spend, I don't know how that shakes out. But what I do know is that we don't have a teaching workforce ready to deploy today that will bring us immediate results. And that is a disappointing thing to say out loud as a parent of 3 children who are in our public schools right now.
Does the state have the money to be able to invest in education as you'd like to see done? Or would we have to cut other programs? Or would this involve, would we have to change tax cuts that are being given out? Would it be pulling money from savings? How would you fund this?
At the top of the press conference, we heard proudly from the governor that we've cut $1.6 billion in taxes over just the time that we've been in office. 1.6 billion, if that were on the table, we would get closer to that gap of $2.1 billion that we are behind in regional investment. Additionally, there's $250 million on the table that is education, but it's earmarked and apportioned off the top spending for private subsidy. So there are options, and it's our job as a legislature to find the revenue. So when folks are saying, oh, it's going to be a bad budget year, we're just going to have to tighten our belts, that is a false narrative. If we actually want to solve the problems and the challenges that folks are facing in our communities, then it is our job to find the appropriate revenue streams to make those targeted investments that will absolutely put our state in a brighter position for future generations.
Yeah, and we saw, I know the governor made the announcement that there's a couple of financial deals he wants to make, one being the Sovereign Wealth Fund, which would be setting aside a bunch of money, taxpayer money, and he wants to make the America Dream accounts. All these things are nibbling around the edges of what's possible for our community if we took those funds and invested them in things that are going to reduce costs later. I think what we have, again, is we're setting ourselves up for more crisis that we're going to have to spend more on rather than doing some of this preventative early work, the early intervention that's going to cost us less down the road. One more question? Anyone? Yeah.
About the COLA increases that are proposed for state pensions that will include the teacher retirement system as well. Any just general thoughts on that?
Yeah. The cost of living adjustment is overdue. I'm very glad the retirees deserve that. Inflation has been outrageous. I haven't gotten to see the final numbers. I wish one of the bills had gone through that we had run because we spent a lot of time reviewing those bills, and so I'm confused. Hopefully they're going to come I guess they'll come out with the budget. I'm concerned that, I heard them saying they're going to cut back public employee match money, and that's part of how they're funding some of this budget. And so that concerns me because that money's not turning around going to our state employees to make sure they get cost of living adjustments in their salaries. What we're hearing is they're going to cut back that match because the pension's in good shape. I'm glad the pension's in good shape, but we have state employees who are making almost 50% under market rates, and we're losing people right and left. And so I'm confused that we wouldn't shore that up rather than sending that money off to other needs.
I have a final remark, too.
Yeah.
The other thing that I just really wanted to quickly remark on is that as we heard from Speaker Hilbert talking about cost containment mechanisms and that there are two levers in order to rein in the expenses on Medicaid. Number one, I want to correct the governor. We are not a fee-for-service state. We are a pay-for-performance state. So all of our contracts are values-based agreements where individuals that are providing those services have to hit certain metrics. So number one, we are not fee-for-service. We are pay for performance. Additionally, when you're talking about only two levers, I think that is also not fully accurate. If we want to contain those expenses, the third option is to increase people's ability to earn higher wages and to be able to provide for their families in a meaningful way, dignity through their work, being compensated fairly for the hard work that they're putting in and day out. And so this idea that somehow we have too many people relying on Medicaid, so we're going to reduce services or we're going to reduce payments to the providers. The other option is to actually make sure that folks don't need Medicaid in the first place. And so if folks are compensated fairly for the hard work that they're paying, or that they're putting in and day out, then that is also a third option in looking at the overall picture of folks who end up on Medicaid because of circumstances outside of their control.
Yeah, I just want to end by saying that, I think about folks in my district who have, I talked to a man recently who's at our neighborhood homeless shelter, who he was in foster care because of abuse. He never received adequate health services. He went straight from foster care to being a homeless youth. And I'm glad the Pro Tem's working on extending foster care services later. But my point is, he didn't get mental health services when he was young. He ended up in addiction, substance use disorder, in part because of that trauma. And here he is, 15 years later. We are spending money on him being in the ERs repeatedly. We're spending money to subsidize his housing. And he's not able to work or have a life of his choosing. And so I think we are choosing to spend money on crisis rather than prevention, and that's the kind of budget I see so far. So thank you for coming this afternoon.